it doesn't matter how big the x-ray is on the screen. If you point to a little gray area that's a little bit grayer or a little bit blacker or a little bit whiter, the patients just kind of nod their head and they're like, oh, yeah, I see what you're talking about. But then they go in the Facebook groups and they're
Yeah.
like, I'm not sure. He pointed at something. And remember, we used to do that like on a 1-inch square, right?
Yes.
So, but even as big as we make these images, it still doesn't tell the whole story. And I think there's still some doubt. So, speak to how Pearl helps build that trust in the dentist-patient
Yeah,
relationship.
when you're doing that exact same
Yeah.
exercise with a patient, you found something concerning, it's a cavity, it's a periapical radiolucency, whatever it is, when you're using it with Pearl, we're colorizing everything.
Yeah.
I like to say it's a Google map filter. So doctor, your patients can
Yeah.
use the exact same
So do
skill
you see
set.
this light gray versus
Yeah,
this
no.
slightly lighter versus this slightly darker gray?
It's like using a map
yeah,
versus
yeah,
Google
yeah,
Maps.
yeah.
You know, like it's night and day. But like the patients who use Google Maps to find your office are using that exact same skill set to see what you see, and then of course accept their treatment plan.